So have you ever had that feeling where, I don't know, your motivation is just completely gone?
Oh, yeah. Or you just can't focus on anything for more than, like, 5 minutes.
Exactly. You can't focus. You feel a bit numb, maybe sort of disconnected from the simple joys in life.
Right.
Well, if that sounds at all familiar, you're tapping into a dilemma that, I mean, it really defines our digital age.
Yeah, it does. We've been doing a deep dive into these really detailed clinical consultations from a practice we're calling Dr. Jack's office.
And what's so striking is the contrast between two patients who, on the surface, have opposite problems.
Completely opposite. On one hand, you have Adam. He's a young guy, just totally overwhelmed, burned out by just constant digital overstimulation. His brain is exhausted.
And on the other side,
We have Brittany. She's dealing with this really severe inhibition, so much performance anxiety that it's led to a complete lack of sexual response. She just feels blocked.
so one is way too much, the other is way too little. They seem totally unrelated.
They do. But our mission today is to connect those dots.
Mm.
We're going to unpack dopamine downregulation and performance pressure and show how they both hijack your brain's ability to just find normal happiness.
And most importantly, we're going to lay out two really clear, actionable plans, a mental and behavioral reset.
Because ultimately, whether your brain is addicted to these intense spikes or it's, paralyzed by fear, the way back is understanding how your own neural pathways have been rewired by modern life.
Okay, let's unpack this, starting with Adam's story and the overwhelming nature of these high-speed digital rewards.
Adam came to Dr. Jack feeling, in his words, this constant heavy exhaustion. Just empty, guilty, couldn't concentrate on anything.
And what was the source?
The core of it was his relationship with high-intensity online content. It started young, around 12 or 13, but what was once just curiosity had become this compulsive, sometimes multiple times a day habit.
And the really destructive part of this, according to the notes, was the need for novelty, right? He was always chasing something new.
Exactly. He told Dr. Jack that what was enough, even 6 months ago, just wasn't doing it for him anymore. He needed more explicit, more extreme content.
Stuff he didn't even really find attractive.
Right, he admitted that. He just needed the hit. And that tells us everything. He was in this relentless pursuit of a peak dopamine hit.
So when he engages with this content, his brain is just flooded with dopamine.
Flooded. We're talking spikes that are just orders of magnitude higher than anything you'd get from a good conversation, a workout, or even real intimacy.
Wow. So how fast does that adaptation happen? Are we talking years before he felt this numb?
You'd be surprised. For some people, the shift can be startlingly fast, maybe a year or two of frequent, intense use. The mechanism here is called dopamine downregulation.
Okay, break that down for us.
So think of your dopamine receptors like little antenna on your brain cells.
Right, waiting for a signal.
Exactly. And when this flood of dopamine comes in constantly, those antennas, they literally start to pull back. They retract to protect the system from being overstimulated all the time.
So the brain's trying to protect itself, but the result is kind of catastrophic. You need stronger and stronger stimulation just to feel anything at all.
Precisely. And the fallout for his daily life is exactly what he described. Emotional numbness, zero motivation, and this crushing feeling that the real world is just too slow, too boring.
Why study for 3 hours for a reward way down the line when you can get an intense one in, what, 2 clicks?
You've got it. And that links directly to the loss of focus, which is a massive complaint we see everywhere now. Dr. Jack's notes really stress this. When your brain is trained for fast, unpredictable rewards, it loses the ability to tolerate slow tasks. Delayed gratification just goes out the window.
And Adam was a perfect example. Jumping from app to app, couldn't sit through a lecture.
His brain was rewired for novelty. That patience muscle you need to read a book or work on a long-term project, it had basically atrophied.
And the damage doesn't stop there. The source material also mentioned he was experiencing porn-induced erectile dysfunction, or PIED. For a guy in his early 20s, that has to be just devastating.
It's incredibly destabilizing. And Dr. Jack was really careful to stress that in these cases, the body is almost always fine. The problem is central. It's in the brain.
So if the body is physically okay, what's the neurological disconnect? What's actually happening during intimacy?
Well, the brain is a pattern recognition machine, right?
Mm-hmm.
And Adam's brain had been conditioned to respond only to this hyper-specific, totally artificial set of triggers.
Like what?
Constantly changing camera angles,
Yeah.
unrealistic scenarios, extreme novelty, really aggressive pacing. So when he's with a real person, one angle, the much slower pace of real intimacy, those conditioned pathways just They don't fire.
His brain is saying, wait, this isn't the signal I've been trained for.
Exactly. This is the sequence. So it doesn't deliver the dopamine rush or the physical signals needed. His brain was basically conditioned to react to pixels, not a person.
That's horrifying. And on top of all that, you have the psychological damage, the shame loop.
Oh, it's brutal. Adam admitted he wasn't even watching for pleasure anymore. He was using it as an emotional anesthetic.
Can you walk us through that cycle? I think a lot of people might recognize that pattern even with other habits.
Yeah. So you engage with the content, you get that brief spike. Immediately after, though, comes this wave of guilt, low self-worth, even self-loathing.
And that feeling of failure just creates more stress.
It does. And what's the quickest, easiest way to escape that awful feeling? You repeat the behavior that numbs the pain. So the habit becomes this maladaptive coping mechanism. It's not about pleasure, it's about stress relief.
And Dr. Jax called this cheap dopamine. You get a reward without any effort, intimacy without any vulnerability.
It's insulation from real life. Why risk rejection or the hard work of a real relationship when you can get a guaranteed hit alone in your room? It just degrades your social skills and reinforces isolation. That's the overload crisis.
Okay, so that's Adam, paralyzed by too much. Let's pivot now to Brittany, who is paralyzed by, well, the opposite inhibition. She had never experienced an orgasm, and at 32, she felt completely broken by it.
A huge psychological burden. But Dr. Jack's first step was so important. Normalization. The data shows this affects a lot of people. Around 10% of women never reach orgasm, and many more struggle. He had to make her understand she wasn't broken, just blocked.
And the sources say her anatomy was fine. The issue was the brain. I thought that sneeze analogy was really helpful.
It's perfect, isn't it? Orgasm is a reflex, like a sneeze. You can't force a sneeze to happen.
Right. The more you try, the more it goes away.
Exactly. And if your mind is tense, distracted, self-critical, if you're constantly thinking, is it happening yet? Am I doing this right? The whole system just clamps down. The reflex gets suppressed.
And Brittany's background was just a perfect storm for this. Perfectionism, high need for control, wanting to perform well in bed.
That, combined with his deep guilt and taboo from a strict upbringing, her inner monologue was the real problem. Don't fail. Should I just pretend so he doesn't feel bad? That kind of thought just drives performance anxiety through the roof.
There was also a key anatomical point that Dr. Jax shared with her, which highlights a massive knowledge gap for so many people.
A huge one. The clitoral complex is so much more than what's visible. It's a vast internal network with over 8,000 nerve endings. And the clinical truth is about 90% of women need direct or very focused indirect stimulation of that network.
And because of her background, she had never really explored that.
Not at all. She was relying on stimulation that just wasn't hitting the right pathways for her body.
So whether it's Adam's overloaded brain needing a reset or Brittany's inhibited brain needing to let go, they both need a structured path to recovery. Let's start with Adam's plan.
Okay, Dr. Jack prescribed what he called the Reboot 90 plan. The goal is simple. Restore the brain's natural sensitivity within 90 days.
And step one is not easy. Complete abstinence.
Non-negotiable. No high-intensity digital content, no masturbation associated with it. You have to starve those overstimulated pathways to let the receptors, the antenna, come back out.
Step two is about controlling your environment.
Yes, because half the battle is just breaking the habit loop. Use blocker apps, get the phone out of the bedroom, and be honest about when and where you're most vulnerable. For most people, it's late at night, alone, idle. You had to remove that opportunity.
And then step three is about replacement. It's not just about stopping something bad.
No, you have to replace that cheap hit with real, sustainable dopamine sources that require some effort.
Like exercise.
High-intensity exercise is great for it. Running, lifting, also things like sunlight, cold showers, deep breathing, and especially real social interaction. These things teach the brain that pleasure is earned, not just consumed instantly.
I think the most helpful part for anyone listening is understanding the timeline, especially that tough middle part.
Yes. Dr. Jack breaks it down. Weeks 1 and 2 are withdrawal. You're going to have cravings, anxiety, irritability. That's your brain screaming for its fix. But then you hit the most critical phase.
Weeks 3 to 6, the flatline phase. That sounds pretty grim. It can feel that way if you're not expecting it. Your brain has stopped getting the artificial spikes, but the receptors aren't fully recovered yet. So your libido and motivation can just crater. You might feel totally flat.
But that's the reboot happening.
That's the brain recalibrating. If you can push through that flat line, that's when the real change starts. In weeks 7 through 12, the rewiring phase.
And that's the payoff.
That's the payoff. Motivation comes back, energy stabilizes, confidence starts to build. because the brain can finally appreciate normal, real-world rewards again. A good meal, a nice walk, they start to register again.
Okay, now let's flip to Brittany's plan, the unblock. It's the complete opposite of Adam's discipline. It's about deep relaxation.
Her first and most critical step was to just remove the goal. Stop trying to orgasm. The only objective is to figure out what feels pleasant, period. No attachment to an outcome.
That takes the pressure off immediately. So how does she deal with the physical tension that anxiety creates? Mindfulness and breath work. So many people, when they're anxious, they hold their breath or breathe really shallowly. Deep diaphragmatic breathing is like a hack for your central nervous system. It forces the body out of fight or flight.
And into rest and digest?
Exactly. You need that physiological switch to allow the reflex to happen.
And what about the self-discovery part?
He suggested touch mapping. It's basically exploratory self-touch, but the goal is just to gather information without judgment. What temperature feels good, what pressure, what rhythm. It's about retraining the brain to associate touch with curiosity and relaxation, not a pass-fail test.
The plan also included sensate focus exercises with her partner.
Yes, and they start far away from the problem. It begins with non-genital touch, like massaging hands or shoulders. The only rule is to feel and give pleasure, with no goal of escalating. It slowly rebuilds the brain's association of intimacy away from pressure and towards safety and relaxation.
And of course, communication is crucial.
Absolutely. The partner has to be an ally in this, understanding that the only failure is staying in that tense, goal-oriented mindset. For Brittany, the path to pleasure was through permission to just let go.
So we've looked at this central dichotomy. The brain can be derailed by overload or blocked by anxiety, but what's so clear is that recovery. It's about more than just changing a habit. It's about rebuilding who you are.
That's the real takeaway. When Adam commits to that discipline, his confidence comes back because he's proving to himself he can endure discomfort for a bigger reward. When Brittany commits to relaxation, she builds self-trust. In both cases, the result is more courage and real self-worth.
And Dr. Jack leaves us with a really provocative thought on all this. This level of unlimited, high-speed, high dopamine content, and the constant social pressure to perform online. It has just never existed before in human history.
Your brain wasn't built for this. I mean, this generation isn't broken. They're just facing a challenge that requires a conscious, structured fight back. The modern world is basically hostile to focus and real contentment.
Which brings us back to the final question for you listening, the one that ties Adam and Brittany together. What is your strong WHY? Why do you want to recover your focus and enjoy real life? Is it for real motivation, real intimacy? Is it just to feel proud of yourself or to feel alive again? That commitment to your why, well, that's the foundation for any successful reboot.